Mothers have trusted Playtex brands for years. Playtex was introduced back in the 1930s and has had a long reputation of innovation and high quality products. However, as I came onto the business, what we were noticing was despite our leading brand position, our brand equity was eroding. It was eroding not only with consumers, but it was also eroding with healthcare professionals. And to really meet that challenge, one of the things we needed to do was to deeply understand our consumers and the healthcare professionals with the objective of making Playtex brands the most preferred brand amongst mothers and healthcare professionals alike. To help us deeply understand our audience, it was really critically important that we found the right partner to help us do that. For that, we did an extensive search and we ended on VDLA. They certainly had a very deep experience across a number of categories. They had a significant amount of expertise in not only branding but new product innovation in a number of areas that we suspected we may need to go into. They embarked with us on a very comprehensive program. It began initially with research with not only the consumers and healthcare professionals, but also with our employees and with key opinion leaders, all very important to making our brand the most we could in the marketplace. In addition to that, they also did retail audits. They looked at the competitive landscape and a number of other activities to give us a very holistic look at our brand and where our brand could go in the future. The findings of this comprehensive approach were very rich. In addition to that, they had the depth and clarity to really drive our path forward. Importantly, what we learned was that this set in motion a very comprehensive restage and repositioning. It also included a number of activities which I'll touch on in just a moment regarding innovation. But the two most important findings that we learned from this that were very critical to our future success was first and foremost that our product, the Playtex Nurser, was viewed as not compatible with breastfeeding. And breastfeeding continued to be on the rise with new moms and something that was very important to them and healthcare professionals. And that's the second part of what we learned, is that when we spoke to healthcare professionals, despite the long history we had in the baby bottle market, we learned from them that they were actually recommending against our product for moms to use alternative baby bottles in the market. And this was because they viewed our product as not compatible with breastfeeding. Product innovation for us was really a critical first step. In order to do that, one of our objectives that we learned from the research was we needed to make a new product that was more compatible with breastfeeding. In order to do that, we clearly worked with our R&D group in VDLA, but also importantly, we proceeded with a clinical study that was done jointly with Boston Children's Hospital, and very importantly, we worked with the healthcare professionals. We brought some of those same healthcare professionals that were interacting with moms into the process and helped us not only design the product, but also design the study. That was very important for us as we were looking to really reestablish our relationships with these healthcare professionals. The other recommendation that came from VDLA was to expand our marketing program, specifically with healthcare professionals. That was an area where our efforts were relatively minor, certainly in comparison to our consumer efforts. What we did with healthcare professionals, with the learning that we had, is we were able to very effectively identify our critical target audiences and really prioritize them. The second thing that was very important with healthcare professionals as we developed this new product was to reposition the brand. The brand previously was positioned as the healthy bottle alternative, and we needed to move that and migrate that to the bottle that was most compatible with breastfeeding. That was another critical element of our marketing program going forward. And the third part, also very important, was an educational program. And that program was designed not only to educate healthcare professionals on our new product and the benefits of our new product and the results of the clinical study, but secondarily also to educate consumers. What we wanted to do with all this learning and with the new direction that we had from a strategic standpoint was to bundle this into a program. And the program that VDLA came up with for us was called the MOM program, M-O-M, and that stood for Mother's Own Milk. And it was a program that was very much an integrated program for healthcare professionals that included lactation consultants, childbirth educators, pediatricians, OBGYNs, and a number of other healthcare professionals that interacted with new moms before and after the birth of their new child. Of course, this program was also designed to reach consumers. The program included many critical elements. It included new creative that I mentioned. It included targeted advertising, and it included very comprehensive educational materials that were available to these healthcare professionals for free, and they in turn distributed them to the consumers. Lastly, the way this program was delivered was also very comprehensive and very unique. It was delivered via advertising. It was also delivered via direct mail. And we also began to attend a number of the conferences where these healthcare professionals were. We made speeches at those conferences, and of course we had all the materials available where they could join the MOM program. The MOM program, at the end of the day, was a huge success by all metrics we established early on. We have a number of critical elements that we were measuring the success of the program against. One of those was healthcare professional enrollment. That exceeded all our targets. We had hundreds and thousands of healthcare professionals enroll in the program and become active in taking materials, educational materials, and distributing them to their patients. Secondarily, the direct response that I mentioned earlier, our direct mail programs achieved a response rate of 10 times the industry average. So tremendous success with that as well. Also very importantly is we became the #1 recommended brand by healthcare professionals. And probably most importantly for everybody out there is that our sales and market share began to rise. We had a number of years where the trend was declining, and we were able through this program alone to reverse those trends and reestablish ourselves as the leading brand and the fastest growing brand in the marketplace. So I would wholeheartedly endorse VDLA. They are excellent brand strategists. They are excellent at branding. They did a terrific job managing all of the market research and activities, and they were able to really dissect the research and bring out the critical insights that really drove the strategy going forward.